let me begin with the new topic, social infrastructure in post reforms India. The brief outline of this discussion is how India has realized the benefit of social infrastructure in the post economic reform era. After that, we will also touch the different area of social infrastructure such as education. Before education, we will first discuss the health, we will have the discussion on water and sanitation, we will have the discussion on housing, and then I will conclude that how entire economic reform process has started the new type of infrastructure, especially in the social sector in the post reform era in India. So, economic reforms and social infrastructure is basically interlinked. The experiences from many newly industrialized countries, as we have discussed in our previous lectures, that they were not really developed just because of the physical infrastructure growth, but they have really developed because of the social infrastructure which they have developed in the field of health, education, sanitation, and also in case of urban planning and utilities. So, when we say the social indicators, health is varieties of health indicators are the part of the social indicators, literacy, number of schools, number of hospitals, number of primary schools, number of high schools, and these are the indicators which shows that how really a country, an economy is investing in these social sectors, the level of drinking water, safe drinking water, the way poor people are having their housing facility, how much government is really supporting for that. And so, this type of indicators are basically the indicators where policymakers today find that what improvement we have done from the past. So, social indicators are equally important with other macroeconomic indicators, as we have seen in many successful examples of the world today. These countries are not really developed because of their constant development only in the physical infrastructure sector, but also in varieties of social sectors which led them in the globalized world. So, India at the time of 1991 and after that, there were many debates in the among the economists that India is not only weak in terms of physical infrastructure, but India is constantly weak in the social infrastructure sector, and if India has to really improve its identity at the global level, if India had to really catch up the benefits of the global integration, then in that case India has to really work upon the complementariness of the social infrastructure with the physical infrastructure. So, reforms in the health sector, if we can see the reforms in the health sector, that revised National Health Policy 2002, which was initiated a long time after the economic reforms process, has really included many other steps. Only 4.8% of the total government expending was incurred on health. India had only 0.7 physicians per 1000 population in 2012. That shows a very bad level of contribution in the health sector. If we can see the percentage of GDP expenditure on health, we are finding here that from 1995 to 2012, the expenditure has little bit increased from the previous level of post reform, where we have seen that the expenditure on health was sometime not even 1%, sometime around 2%. Now, we are finding that due to the more emphasis on the health expenditure, government has really realized to contribute more expenditure on the health, and on an average we are finding that it was from 1995 to 2012, we are finding that government has constantly worked upon such expenditure, and it was around 4%. So, FDI in healthcare, if we can see the one of the part of the reform, 100% FDI is allowed for health related services under automatic route. Medical and healthcare equipment attract lower tariff and higher depreciation. Income tax exemptions for those health those hospitals for the 5 years was also provided to the hospitals located in Tier 2 and Tier 3 cities and rural areas to foreign investors. The National Rural Health Mission has also sanctioned more than $10 billion for capacity enhancement and upgradation of the healthcare facilities. At the same time, additional $1 billion for upgradation has been sanctioned by the Government of India for institutions like AIIMS and government medical colleges. In case of health, we also find that National Rural Health Mission 2005 was launched in order to improve the rural public health system. At the same time, the major focus was to provide effective health care to the rural population in the country through this scheme. In spite of leakages in the NRHM, it has contributed towards increasing public health infrastructure in the country. That is one of the big achievement for this country, because before that there were really mismatch between the demand and supply of the rural infrastructure, especially in the health sector. Government has a vision to merge NRHM with National Urban Health Mission to form the National Health Mission. After discussing health, we cannot really ignore the Government of India, which has decided to create more than 100 community colleges in coming years. Public private partnership and tax concessions are provided in education sector, and Foreign Educational Institutions Bill 2012 has been also introduced to open doors for reputed foreign universities and to attract the investment in education sector. Public expenditure on education, if we can see here, compared to 1991-92, which was 3.8%, has increased in 2000 to 2001 at the level of 4.28. In 2005 and 6, we found the investment has increased at the level of decreased little bit at the level of 3.45, and 8-9 again decreased compared to the 2001 level 3.78. This expenditure also shows that on health and education, India has almost equal weightage, and we find that close to 4% expenditure as a part of GDP is on health and expenditure in the post economic reform era. Literacy rate has improved not only in rural sector, but also in the urban sector. The India's overall literacy rate, which we can see here in 1991, we find that the overall literacy rate was 52.21%. In that 36% in rural area and 67% in urban area. While in 2001 we find that only in rural area the literacy rate was around 59.4, while in urban area it was 80.3%. The total literacy rate has improved from previous level of 52% to 64%. While in 2011 we do find that the literacy rate has improved in total 74% around, and while there is a improvement in the urban literacy at the level of 84%, and in rural literacy it has around 67%. So, percentage increase in 2011 over 2001, if one can see that we have the fast increase in literacy due to the various program in rural India, that is around 14%, in urban it is around 5%, the total percentage is 14. Credit goes to recent act, Right to Education Act 2009. The main objective of the Right to Children to Free and Compulsory Education Act 2009 was to provide free and compulsory education for all children in the age group of 6 to 14 years. It also lays down the norms and standards relating to building an infrastructure at the school level, apart from other norms about how to provide the education to the children at the grassroots level. The number of schools, if we can see in 2011 and 12 compared to 1991 and 92, we do find that the improvement is in the in a much better way. Almost it is close to 80% growth in the number of schools in reformed India. So, when we have started reform and when we are little more mature in our reform, we find out that the number of schools has really increased, and this is because of the government constant expenditure as a part of GDP in education. So, in case of higher education system of India is the largest in the world. A very large number of institutes and universities have been also set up, including technical education, medical, legal, dental, nursing, teaching and polytechnics. Till 2006, private institutes accounted for about 63% of all higher educational institutes in India and 52% share in number of students. So, the share of private universities, including deemed universities, is about 30% in the higher education in India. This shows a very better education facility in India. Now coming ahead, going ahead to the water and other facilities, other infrastructure, we are finding here that the safe drinking water is one of the major challenge for India, not in the reform India, but from the pre-reformed and after the independence. And we also find that India, being a vast economy and having a big populated economy, is still facing this challenge as one of the bigger challenge. In 2001, only 24.3% of rural population has access to tap water, which slightly increased to 30.8% in 2011. There are cross country wide disparity in the access to tap water. For instance, only 3.7% of rural population in Jharkhand has access to tap water in 2011, while in Andhra Pradesh it was 63.4%. So, we find that there is a wide range of disparity in terms of getting the very important part of our life, that is water. And if the statistics of Jharkhand is 3.7, that is one of the alarming percent for India, because this is one of the tribal state where we can see that the public expenditure has or the private support has not really worked, especially in the water sector, while in states like Andhra Pradesh or in states like other literate and other developed states, the condition of even in sanitation and water is much better. So, investment in rural drinking water, if we can see the contribution of a state and center in 11th 5-year plan was much by the state, less by the center. While in 10th plan we find that the center has more provided fund compared to the state. In this particular slide, the red color shows the central government expenditure in crore rupees, while the yellow color shows bar diagram shows the state level expenditure in rural drinking water. Compared to 8th 5-year plan, where we have seen that 8th and 9th, we are seeing that state government has really more expenditure than the central government. Only the 10th 5-year plan, we are saying that we are seeing here that only central government has more expenditure compared to the state government, but in all 8th, 9th, 10th and plan and 11th plan, we are finding that more drinking water facility expenditure on more drinking water facilities provided by the state government. So, after this we can also see here the providing sanitation facilities. Providing substantial sanitation is one of the major challenge today also, one of the major challenge it was at the time of economic reform also. So, the Indian government is committed towards achieving Millennium Development Goal and universal sanitation coverage in the country by 2022. The current rural sanitation coverage is only 32.7%. That is a very low figure At the same time, new strategies and approaches have been formulated by the Ministry of Drinking Water and Sanitation. Nirmal Bharat Abhiyan, initiated in April 2012 by achieving total sanitation. Nirmal Bharat Abhiyan is a community based and people centered approach based on the post achievement initiative. But at the same time, we also find out that there are initiatives by the government of India today in the name of Swachh Bharat Abhiyan, and this is again the part of the previous steps taken by the previous government, but this particular sanitation scheme again needs proper attention at the state level and proper support by the state level. At the same time, a private infrastructure support is also needed, because government alone really take care of the entire expenditure and entire coverage of the sanitation for the vast population of India. So, total sanitation campaign was launched in 1999. The total sanitation campaign increased sanitation over coverage from 22% in 2001 to 31% in 2011. The Gram Panchayat have been encouraged by introducing Nirmal Gram Puraskar in 2005 that attended 100% sanitation coverage. This progress, however, is unsatisfactory. Still 600 million people in India are under open defecation. So, expenditure on total sanitation campaign, if we can see here, we have a very increasing data compared to 2007 and 8. We are finding that in 2008-9 we have much increased data. Again we have increased expenditure in 2009-10. We have a very high level of expenditure in 2010 and 11, but little less in 2011 and 12. So, after this we can also see here the basic infrastructure for all is the framework for urban housing, in which in the 1990s witnessed a large involvement of urban local bodies in providing housing facilities. However, a scanty budget and insufficient land banks and acquisitions hurdles and lack of capacity has been prime reason behind low level of development in providing housing infrastructure facilities. Jawaharlal Nehru National Urban Renewal Mission started in 2005 addressed the issue of both housing and other infrastructure in India. Urban housing shortage, if we can see here that in million units 23.4 for EWS, and at the same time 3.8 million units and others 0.03 million units in 2012. So, to conclude, this public expenditure on health and education is not adequate for meeting the growing demands of the people. We need a better public private partnership here, different models to really control the huge demand, especially in the social infrastructure sector, such as the providing safe drinking water, sanitation and urban housing, which is still a big challenge for India. So, huge investment are needed from the private sector, both domestic private sector as well as the foreign or international private sector. So, India, which is really looking for a better way of reforming the economy, this type of reforms cannot ignore the expenditure on the social sector, and at the same time when we say expenditure, total expenditure, this total expenditure is not only the private expenditure, but it is also the combination with the public and private both. So, when we are getting the investment in the PPP mode, especially in the physical infrastructure development, we do have very less projects in the social infrastructure development projects. So, government may have to think again for providing a new type of avenues for those investors in coming days, so that more better investment may be received. At the same time, the better utilization and better honest attempt is needed to really have a better India and a better Swachh Bharat. Thank you.